I want to first welcome each and every one of you today to My Health, Your Health with Kevin and Vaughan. I want to first of all start off with Dr. Crenshaw. Dr. Crenshaw, welcome to My Health, Your Health today. Thank you so much.
Thank you.
God bless you. And ladies and gentlemen, also our distinguished guest here today, Dr. Georges Benjamin. Doc, thank you so much for your time today, sir. So glad for you to be with us today. How are you?
Absolutely doing well. I'm glad to be here. Thanks for having me.
Yeah, thank you so much. Well, ladies and gentlemen, the purpose of today's broadcast with Dr. Benjamin is to talk about what is happening all across the globe, ladies and gentlemen. Just to give you a little heads up as well, wanted to talk today, we're going to be talking about mask or no mask, right? Whether we should be wearing a mask or not wearing a mask from our distinguished guest today. How about schools, right? We want to talk about the schools for our young people. We've been hearing a lot about that, doctors, about this. The COVID, right? What's going on with COVID, Dr. Benjamin, from your perspective? Because he is, ladies and gentlemen, he is the executive director of the American Public Health Association, ladies and gentlemen. So that's very important. And I believe he has a few things he can tell us about today as well. In addition to that, Doc, we're going to be talking about the vaccines. And I'm learning, so I don't know anything about these areas other than I need to do certain things. And also we're going to talk about the numerous opinions about the COVID shot from Dr. Benjamin and Dr. Crenshaw's perspective as well on top of that. Well, let me tell you a little bit first about Dr. Crenshaw. She's a nurse, recording artist, book author, definitely a great conference speaker, healthcare consultant, and CEO at Excel CDC. So thank you so much, Dr. Crenshaw, for being with us again on My Health, Your Health. And let me go ahead and read, I believe Dr. Carnes is coming in right now, so we'll go ahead and bring him in as well. So we'll kind of wait for him to come on in. But welcome, guys, to My Health, Your Health with Kevin Vaughan. We're going to be talking about an important topic today. And Dr. Carnes, welcome, sir, to My Health, Your Health. How you doing, sir?
Afternoon, blessing to you all. I'm well. I apologize. I was on a conference call.
I understand. Yeah, we understand. I tell you, he was busy. I know he was doing something.
Oh man, we got caught up into the conversation.
Amen. Amen. We understand. There's a lot going on today, and that's why we are here today. Ladies and gentlemen, that's Dr. Larry Carnes. Dr. Larry Carnes is a leadership coach, transformational strategist, conference workshop, and motivational speaker. Dr. Carnes, welcome, along with Dr. Crenshaw and Dr. Benjamin as well. Thank you so much for being with us today. Amen. Well, let's get started. I want to read Dr. Benjamin because of his distinctiveness, if you will. He, again, is the Executive Director of Public Health Association for Science, for Action, and for Health. Dr. Georges Benjamin is known as one of the nation's, oh, I love that part, one of the nation's most influential physician leaders because he speaks passionately and so eloquently about the health issues having the most impact of our nation today. That's why we wanted to have this program for you guys today. From his firsthand experience as a physician, he knows what's happening when preventive care is not available and when healthy choice is not an easy choice. As executive director of the APHA since 2002, he is leading the association push to make America's the most wealthiest nation in one generation. And ladies and gentlemen, his bio is really long. You can actually look that up online, so I won't belabor that, but I want to welcome again Dr. Benjamin, Georges Benjamin. Thank you so much, sir. Thank you so much for being with us today.
Thanks for having me.
Well, Doc, let's get started if you don't mind. First of all, Dr. Crenshaw, do you have any opening comments about this wonderful time that we're in of COVID, if you will? And also, Dr. Carnes, I'll go to you next. But Dr. Crenshaw, any opening comments before we get to Dr. Benjamin?
Well, I think what's most important is that every platform that we can take to make things more clear and that individuals are more informative as it relates to what's going on today. We have a lot of messages out there, a lot of mixed messages, and sometimes people don't take time to make sure they thoroughly understand. Sometimes they don't do their research or however, which creates a somewhat an informative chaos in our society. So I think as much of a platform that we can create to answer some questions is certainly something that we should be doing at this time.
Yeah, thank you so much. Dr. Carnes, any opening comments, sir?
No, just honored to be here. I kind of echo what Dr. Crenshaw said. You know, information is power if we apply the information.
Yes, sir.
But it's only going to be power if we're willing to receive that information and then apply it. You know, you and I had a conversation. I talk about from truth to truth.
Yes, sir.
We can receive the truth, but the truth doesn't become our truth until we apply the truth that we receive. So I'm believing that with this platform today, that some truth will be disseminated, and then hopefully people will take that truth and apply it, and it becomes their truth.
Yeah, thank you so much, Dr. Carnes. You know, before we get to Dr. Benjamin, I wanted to read some stats real quick. This is from the state of Georgia. This is Cobb County, the county that I'm in as it relates to COVID. This comes from the CDC. Confirmed confirmed COVID cases, 85,000. Deaths, about a little over 1,000. Georgia cases, 1 million, 1 million cases there. I think our whole state is 10 million. Deaths were 21,000 in the United States, as of course, Dr. Benjamin would know, and this is as of yesterday, I believe it was 36 million, and then deaths were 627,000, and then global cases is over 203 million, and then deaths were 4 million globally. So with that said, I want to go straight to Dr. George's Benjamin. Dr. Benjamin, thank you so much for being with us again on My Health, Your Health with Kevin Vaughan. God bless you today, sir.
Look, I'm glad to be here. And, you know, at the end of the day, you know, I like to give out information, but what I really like to do is give people a way to think about problems.
Yes, sir.
Because it's not what I say. You know, you should verify everything that I say.
Yeah,
But I want to give people a way to think about it,
yeah,
so that they can make informed decisions for themselves. Because I'm a strong believer that if you empower people to figure out how to get the information and where to get the information from trusted messengers,
yes, sir.
then they don't have to listen to people who think they're experts like me.
Amen. That's great, Doc. That's great. Well, I appreciate that so much. Well, Doc, one question I had for you, and I wanted to ask about, can you talk, and it don't have to be necessarily in this order, but can you talk in any way you want to go with this about the mask situation? You know, people are a little confused in the United States and maybe around the globe, but specifically in our nation, people are a little confused about the mask or no mask. Could you talk a little bit about that from your perspective?
Yeah, the answer to that is real simple. Wear the mask.
Yeah.
And let me just make this real down to earth and real simple.
Yes, sir.
It is real clear that in most cases, there are three ways you get an infectious disease like this.
Okay.
Someone's in your proximity, and everyone's had somebody speaking to them too close,
yeah,
and had the stuff come out their mouth, in their face, right?
Yeah.
Real simple.
Exactly.
What does the mask do? It blocks those big droplets from coming in your face.
I love it.
You don't get infected. Second thing it does, there are little small particles out your mouth. They float in the air. This mask isn't as good as preventing that because, you know, there's gaps around the side.
Yes, sir.
But it does reduce your risk. It's not 100% by any means. And, you know, there are various quality of masks,
yes,
from this, you know, the paper mask, like a surgical mask, to this cloth mask,
yes, sir.
to that N95 mask, which fits really tight on your face.
Yes, sir.
That blocks those fine particles. Okay.
Yes,
They're
sir.
really tight masks. But that, and yes, you can get infected that way, but it's not the common way.
Yes, sir.
And then the third thing is someone coughs on their hand, touches their hand and touches a doorknob.
Yeah.
And shortly afterward, you come along and touch it, and then you touch your face. It turns out that that's not a common way for people to get infected.
Okay.
That's the third way. So mask, by the way, if you're wearing a mask, you're less likely to touch your face. And so every evidence that we have is part of a suite of protections.
Yes.
The mask, if there are two things you could do, one would be get vaccinated, and the second thing would be to wear the mask.
Oh, I love it. That's straightforward, ladies and gentlemen. Hey, ladies and gentlemen, this is My Health, Your Health with Dr. George's C. Benjamin, ladies and gentlemen. He is the executive director, ladies and gentlemen, of the American Public Health Association, along with Dr. Janice Crenshaw, and Dr. Larry Carnes is with us today as well. And we got to keep it simple, Doc. Thank you so much for that. Just wear the mask, wear the right mask, wear it properly, and we'll be fairly good, Doc, if I understand you correctly, for sure. Well, Doc, as you know, our children are going back to school as we move to the next area. Can you talk a little bit about what's going on? I know our teachers are concerned, but we got administrators that are saying different things according to the news as well. Our children and moms and dads are agreeing or disagreeing about whether their children should go back to school as well. Can you tell us a little bit what's going on from your perspective in the school areas?
Well, you know, the issue with the trade-off was we made a trade-off last year. End of the last year, and basically a year and a half, our kids lost
Yes,
And
sir.
we made a trade-off. We said it's important for them to be safe from the infection. So we pulled them home.
Okay.
And of course, one of the tragic things when you do that, we learned how important it is for kids to interact with one another,
Yes, sir.
for them to be able to play. And when you trade off the risk of infection against those other mental health and sociological problems, we understood that it's important to the extent that we can reduce the infection, it's more important for them to get back in class.
Yes, sir.
Because a year lost is a big year.
Yes, sir.
And for communities of color,
Yeah.
that is a really big problem because many of our kids already start with behind the curve.
Yes, sir.
It was very important for our kids to get back to school, but it's also very important for them to get back to school very safely.
Yes, sir. Exactly. So I guess if you wouldn't mind, Dr. Benjamin, who actually makes that decision for the schools? Each state has their own system for that. How does that work?
Yeah, the school boards do. At the end of the day, you hear all these governors making these pronouncements.
Yeah.
But let me tell you something. The school boards control those schools,
Okay.
right? Overall, and principals control their school.
Okay.
So this is a decision of the school board and the principals. Now, the governors think they can make
Yeah.
pronouncements, but I got to tell you, I was a health officer in DC,
Yes, sir.
and I was the health officer in the state of Maryland. And every time we try to put our hands in the school system,
Wow.
we brought back a nub.
Even with the science? Even with the science?
Well, no, I mean, my point is the schools control their authority.
Okay.
All right. And if you give those superintendents and those principals the right information,
Yes, sir.
they're going to protect those kids.
Okay. Gotcha.
Okay. And so I guess I'm siding with the principals and the superintendents over the governors who I think are making bad decisions. Now, there's some governors making good decisions, right?
Yes, sir.
But for those governors making bad decisions, I'm siding with the school boards and the principals of those schools, and in most cases, the teachers' unions.
Gotcha. So they're getting good information. That's good to hear. I just didn't understand that process. They're getting the right information. Obviously, they're responsible for that part of the system, and that's good to hear. What concerns me sometimes is just the conflicts. They don't, where the teachers are not agreeing with the board or the board's not agreeing.
Yeah, well, they have to work through that. But remember that the one thing that they're educators.
Yeah.
They know how to take the science, they know how to read the science. And in general, I mean, they have to work in a political environment, but
Yes, sir.
when they say we want our students to wear a mask, that's the right decision. If they say the students should not wear a mask, that's the wrong decision.
Gotcha. I'm with you on that. Hey, ladies and gentlemen, this is My Health, Your Health with Dr. Georgia C. Benjamin. He is the Executive Director, ladies and gentlemen, of the American Public Health Association. We're going through questions that will affect our families and affect our neighborhoods as well. Doc, can you tell us what's happening from your perspective on COVID right now, sir, and any other area related to that today, as far as the latest information and what we should be doing?
Let me just say that we're having a very terrible outbreak with a variant of COVID called the Delta variant, which is quite frankly a pandemic. It's an epidemic amongst people that are unvaccinated.
Yes, sir.
It is less of a problem for people that are vaccinated, but it is a big problem for people that are unvaccinated. And, diseases tend to go after the people that are not protected,
Okay.
and the people that are most vulnerable.
Yes, sir.
So the first phase of this outbreak a year or so ago affected the older population because they were the most vulnerable,
Yes, sir.
and it impacted communities of color.
Yes, sir.
Because we were vulnerable because of where we worked, meaning we couldn't stay at home and work. We had to go out in mass. And the fact that we were disproportionately impacted by chronic diseases, which put us more at risk if we got infected.
Yes, sir.
Now it has impacted our kids because that's where it gets to go.
Yeah.
It's young people and kids because they're unvaccinated.
Right.
And this new variant is not the old variant. The old variant was not as infectious to young people as much as this new one is.
Okay.
And that's the problem. And so
Gotcha.
for whatever reason,
Yes.
the communities that were in our southern states in particular,
Yes, sir.
they tended to be the more conservative red states, where the health outcomes have always been the worst in the nation for many years, right?
Yes, sir.
It's unfortunate, but for heart, they have more heart disease, more lung disease, more cancer, more kidney disease, and now they got more COVID. So there should not be a surprise. The states that are having the big outbreaks right now,
Yes, sir.
they also tend to be the states where their elected leaders in many levels denied the pandemic, that didn't get engaged, and that done, in my view, the things that protect their populations using the science.
Yes, sir. Fantastic.
Now, there's some that certainly have,
Yes, sir.
but in some of those places they did not.
Awesome. Doc, could you give us an overview of how our health system works in our nation? Just a general overview of how it starts from the top down.
Yeah, you got most of your lifetime to hear this story.
I wanted to just understand a little bit who's in charge up there at the top and how does it come down to the nation's capital, from the capital down to the states.
Well, let me just say that we have a private sector health system. Medicine is both a profession, of course, it's a business.
Yes, sir.
And we have private hospitals and private doctors. They are funded through a range of our own individual dollars out of our pocket, but we have fundamentally an insurance-based system. And that's so you can spread the risk, theoretically reduces the cost.
Gotcha.
So that's the delivery part of it. And we have a range of private sector organizations that help us. We call them safety net programs. These are free clinics, private clinics, faith-based clinics. By the way, the faith-based community has been enormously impactful in improving the health of our country.
Yes, sir.
And they work collaboratively, sometimes singularly, to provide services to try to promote the health of the population. Having said that, we did have a regulatory framework, but we have a federal government,
Yes,
like
sir.
everything else,
Okay.
that provides some overarching rules around the way that health should be delivered.
Yes, sir.
But the entities that credential your hospital to decide whether your hospital is qualified and competent is your state and local government, are some national organizations that go in and inspect your hospitals.
Yes, sir.
And then the federal government provides some oversight because they inspect, because they pay almost half the amount of dollars for healthcare in this country.
Yes, sir.
So since your tax dollars are in that, they reserve the right to go and inspect. So Medicare and Medicaid,
Gotcha.
which pays for a lot of services, therefore those the federal government also regulates those hospitals. So
Yeah.
a bunch of regulatory bodies regulate it, but all delivery pretty much is delivered at the local level by doctors in your community,
Yes, sir.
hospitals in your community, clinics in your community.
Fantastic. Thank you so much for that. Hey, ladies and gentlemen around the globe, if you're just joining us, this is My Health, Your Health with Kevin Vaughan and my wonderful guest today, Dr. Janice Crenshaw, Dr. Larry Carnes, and our distinguished guest, Dr. Georgia C. Benjamin. Ladies and gentlemen, he is the Executive Director of the American Public Health Association. So excited about him being here with us today. Doc, as we move forward, I want to get to Dr. Crenshaw and Dr. Carnes here later as well. Can you talk about what's going on with the vaccine today? Because everything's in the news.
Yeah.
Every day it's in the news. Could you give us some updates on that, please?
Let me just make, it's at this point in time, it's get vaccinated or get COVID.
Gotcha.
And let me just remind folks, the vaccine does two things.
Okay.
It's designed to do two things. First of all, it is designed to keep you from getting real sick,
Gotcha.
hospitalized, and die.
Okay.
And for that, it is really very effective. All the vaccines we have right now, pretty good at doing that, okay?
Yes, sir.
Second thing it does, it dramatically reduces the risk of you getting infected from the first place and spreading that disease around, think about it as being a carrier.
Okay.
It does that really well,
Yes.
not as well as it protects you from getting real sick. And so what you have to think about this is it does these two things. So for people that are vaccinated, we're seeing they're not getting real sick and dying. And also people who are vaccinated, we now know that they may get infected, they may become carriers, but not as bad as they would if they weren't vaccinated.
Yes.
But you hear a lot about from people that say, look, it was made too fast.
Yes, sir.
It was actually made over 20 years, okay? They just produced it real quick. They did the scientific studies real quick.
Gotcha. Good.
But we've been studying this for 20 years.
Okay, gotcha.
Second thing they'll say is, Well, we don't know what's going to happen in the next 10 years. You're absolutely right. I cannot tell you the impact of this vaccine 10 years from now. What I can tell you, though, is the impact of COVID next week if you get it. I can tell you the impact of COVID over the next year if you get COVID. And I can tell you that if you look at those two things,
Yes, sir.
I know what the vaccine did over the last year, and I know what happens if you get COVID over the next year. And my advice as a physician is take the shot.
Right.
Because it's worse to get the disease than it is to take the vaccine.
Gotcha.
And even you hear about these breakthrough infections,
Yes, sir.
but even people that have mild illness, they're mild, by the way, breakthrough infections, they still do much, much better than people who are totally unvaccinated.
Wow.
And if you're of color and you have diabetes, hypertension, you're obese, you have kidney disease, you have lung disease, your risk of getting really sick, unvaccinated, is much, much higher than someone who's
Yes,
young
sir.
and healthy.
Yes, sir.
But even if you're young and healthy, you can get this thing.
Absolutely. Hey, ladies and gentlemen, here on My Health, Your Health today with Executive Director there, Dr. Georgia C. Benjamin, ladies and gentlemen, Executive Director of American Public Health and Association. You know, Doc, you talked about, I know you just mentioned prevention, which is a great word. I love prevention. But the next thing you mentioned earlier was about research. Where is the best place for us to go to research what you're saying? Everything you're saying is great, but is there a specific area that we can go target to get our information so we can do our own studies and reviews, if you will?
Yeah. So a couple of things. First of all, you can go to the website of the Center for Disease Control and Prevention.
Yes, sir.
You can go to the Ad Council. The Ad Council has a website that you can go to that has a series of question and answers.
Gotcha.
I tell people to go to trusted messengers. So my organization is APHA.org,
Yes, sir.
Infectious Disease Society of America, the Center for Disease Control and Prevention. You can go to the World Health Organization's website. It's just difficult to navigate it.
Yeah.
And I got to tell you, the other place that you ought to go is talk to your doctor. Talk to your own healthcare provider. If you have a relationship with a healthcare provider, talk to them, because you want to go to someone you trust.
Yes.
I hope you'll trust me, but I prefer you go to somebody that knows you, talk to you about your medical condition and you know, we've been doing some other things. We've been empowering people in the community. We've been empowering faith leaders,
Yes, sir.
barbers and beauty,
Yeah.
because you know, lots of stuff happening in that barber shop, right?
A lot of networking.
And that beauty shop, lots of good information, and sometimes some misinformation.
That's
So we
correct.
spend a lot of time educating those folks. We did a lot of this during the AIDS epidemic, and trying to get the right information to communities, and then community leaders.
Right.
You know, Mrs. Jones down the street that it knows everybody's business, right? And and her cousin,
Yeah.
and the folks that actually are the power brokers in the community.
Yes, sir.
We're spending a lot of time trying to empower those power brokers in the community, so they can aid their communities to get people out and get vaccinated and make sure they get treated right.
Yes, exactly. Doc, I'm glad you mentioned that, because ladies and gentlemen, I want to definitely give a shout out to all our advocates and all our first responders, everybody at all levels. You guys are amazing. You talk about heroes of getting stuff done. You guys are definitely heroes. So I got some folks in the healthcare area. I just love you guys, and we do lift you up for what you do. And of course, all our advocates for the community are relentless. I mean, they're not going to give up. They're going to get you.
No, not at all.
They ain't going to give up. So we take our hands and hats off to you guys. Clap my hands and hats off to you for that. But at this time, I want to turn this over to Dr. Crenshaw, and then we'll go to Dr. Carnes after. Dr. Crenshaw, anything for Doc today? Thank you so much.
Yes, Dr. Benjamin, I have a couple questions. Just want to piggyback certainly on a couple of things that you were sharing as it relates to the vaccine. So I just want to make reference to an article that was published by the CDC. I think it was around July the 30th. And it was given an explanation as related to chickenpox and how that relates to COVID-19, that kind of thing. And that the reproduction rate of an infectious pathogen can be affected by various factors. And some of those factors were some of the things that you just shared. Simply wear a mask, which I totally agree with that. You know, I'm a nurse, come out of healthcare, so wear a mask, because certainly that's going to lower certainly the risk. So that's such as preventative health measures, wearing a mask, and the presence of immunity. And the next statement was acquired either naturally or through vaccination. So I guess my question is where is the equation as relates to also information, coaching, or just sharing the importance of individuals naturally building their immune system in all of this? Where does that fit in this equation?
Well, you know, clearly the healthier you are, the better you're going to do if you get infected. But this is a disease, a virus that none of our bodies have ever seen before. And so even though you may have a strong immune system, it's never seen this before. It does not know how to fight off the virus.
Wow.
And so even, people are out doing all kinds of things to make sure their bodies are stronger. Yeah. And they should do that. Yeah. But since the body has never seen this virus before, it needs to be instructed. That's what the vaccine does. It teaches our bodies how to react to this virus, and it teaches them to do it quickly. So that's going to be important. I think the other thing that CDC study showed was the fact that this virus is more infectious than some of the other viruses that we see, and they try to give people a sense of how infectious this is. So the problem is I don't think most people understand how infectious chickenpox is.
Yes, sir. And
how infectious measles is.
Yes, sir.
So let me give you from my perspective. I was an ER doc for many years. And when someone would come into the emergency room, and some of your listeners may have had this experience, and somebody comes in the ER with measles or chickenpox, it's like a fire drill. The staff goes absolutely nuts to try to separate that person from everybody else, particularly if there's a pregnant person in the room.
Yes, sir.
Because if you got measles or chickenpox and you walk through a room, you're going to infect somebody in that room. It's that infectious. And so what they're saying now, this Delta virus is as infectious as chickenpox. Wow. So when someone's walking through the room and they've got a lot of virus in their system, they're likely to infect other people that are in close proximity to them in the room. Wow. So they were trying to give people a sense of how infectious it is. And in that situation, again, even if you have a really great immune system, you're eating all the right stuff, you're healthy, you exercise every day, if your body has not seen this virus before, you're much more likely to get infected by it. It's much more likely to hurt you. Now, you may very well do fairly well with it, all in all. Right. But that, again, remains to be seen based on how healthy you are.
Dr. Benjamin, I had one other question, as it relates to that. Certainly, I agree with you when it comes to remain to be seen. And I guess one of the other questions that I have is to speak, in reference to the information that is now being generated relative to the current vaccines and them being 4 to 6 months effectiveness and the possibility of boosters and that type things, which for me, relative to data, we talk about data, seems to indicate that data is still being collected to support the full FDA authorization that has been granted these vaccines, and not just the emergency use. And we know that's a whole nother topic because people don't understand the difference of emergency use authorization versus full, et cetera. Yeah. So I guess my question is, where are we as relates to that? And now we got this new thing, this new revelatory information coming out about, possible boosters because it's only like 4 to 6 months, et cetera.
Let me take on both of those. So first of all, let's just try to clarify the emergency use authorization versus full licensure. So it's important for people to understand that this vaccine has been approved by the FDA for use. They've used a process called the emergency use authorization process to approve it. And that means they've looked at a lot of people and they've looked at the data and they've looked at the cost, the benefit of doing it versus the risk of people getting sick from it. And they've documented that the risk of not being vaccinated outweighs any risk from getting the vaccine in almost everybody. that's had it. And millions of doses have gone out there, and that risk calculation has been demonstrated to be true. That process was put in place to allow for, in general, for new drugs to come on the market that might benefit somebody, where there's a lot of evidence that it'll work, but they thought it would take a long time to get the data because the number of people with the disease were very small, like in rare diseases, or they thought it would take a long time to get the data. So it turns out that since this is a worldwide pandemic and millions of people are impacted, we were able to get a lot of data really quickly, not just in the US, but around the world.
Yes, sir.
The difference between the approval with the EUA and full licensure is that the FDA is not just approving the product, but they're approving the manufacturing process. They go into the facility and they look at the hospital, they look at the lab, they license the laboratory, the manufacturing process. And if you think about it from a medical perspective, it's like going in and doing what we call the Joint Commission is one of those, you asked about who regulates hospitals and healthcare systems. There's a national entity that goes in and regulates your hospital. And they go in and they look at the facility, your transportation system, your HVAC system. They look at everything. They look at your lab. They look at the way the medical care is delivered. And that's licensure, okay? When they go in and accredit a facility, they're looking at the whole process.
Yes, sir.
So that's what FDA does for vaccines. But when they approve, like the approval process under EUA, it's kind of like them saying, your doctor's okay, your nurses are okay. They kind of look at an individual activity in that hospital, which is very different than certifying the whole hospital.
Gotcha.
So you can imagine certifying a doctor or a nurse or a particular procedure to happen in an entity can happen very quickly. To prove the whole process and the facility takes months and months. So that's why it takes longer to do it. So EUA, very targeted approval of the product. Licensure, approval of the product, plus the facility, plus the process, okay? And when they do that, by the way, they ask a lot more questions. When we originally did the EUA, they approved it for, they did the studies to see if it reduced the number of people who got sick, reduced the number of people going to the hospital, and reduced the number of people who died. That's what when they initially do those studies, that's what they looked at. They didn't look at whether or not it made you infectious or not. They went back and looked at that later and then said, okay, here's what we know about that, okay? And then the Delta variant hit and it totally changed. It didn't change the first part, you know, how sick it made you.
Yes, sir.
Delta variant changed how much it makes people sick and infectious, okay? That's the first thing. Then you asked about boosters. Well, you know, they've been tracking all the people that do those research studies. They started doing those research studies in about March or April of 2020. And so they did the research studies and they have continued to follow those people along for over a year now. Little, you know, since those people that just started. And they've added more people and they've been getting more data. And when they did those studies, Dr. Crenshaw's question, I think, is how long does the blood test, the antibodies they measure in your blood, how long are they still there? And the answer is, turns out that while they go down over time, for almost all people, it's remained at a level that nobody thinks you need to have a booster yet for the vast majority of people. Now, who's different? Dr. Crenshaw asked about people based on their natural immunity. We know that there are some people who, for one reason or another, even though they got fully vaccinated, they got their 2 shots,
Yes, sir.
they didn't get as protected as we would have want them to. Remember when they say you get the first shot, your immunity goes up a little bit, and then you get the second shot, it goes up even higher.
Okay.
And now there's some evidence that if you get a third shot, it goes up even higher, or it if your immunity goes down, it brings it back up again. And that's what a booster does. And what they're thinking is, at least right now, is that the kinds of people that will probably need boosters, and they may make that announcement any day, any week now, will be people with underlying immune problems that know it, people who are on cancer, chemotherapy, people who are high dose steroids. You may be on that for asthma or some other infectious, inflammatory disease, people with chronic kidney diseases. So they're coming together with a group of people that they think, based on what we know about the science, immune systems are depressed and probably didn't get as much of a benefit from the vaccine. They got some, but and a lot of those people, the people that are getting breakthrough infections right now, not all of them, but some of them. So when you do a booster, you have to make a couple of determinations. Number one, do you give them the full dose or do you give them a partial dose? And do you give them the same shot that we gave them a year ago? Because the shot we got for a year ago was for the original virus, original variant. And the question is, do you now give them the new booster? Does it include the Delta variant in that shot? Even though the vaccine we got earlier protects the Delta to some degree, it isn't 100%. It's not even 90%. So the question is, do they now add the Delta variant in that? And I know they're doing the studies to try to figure out what's best. So I think what we will hear after all that is that we're going to be giving boosters most likely to people who have some immune dysfunction or some level of immunity, which isn't 100%. And people with chronic kidney disease, high dose steroids, on cancer, chemotherapy, and maybe have some other immune diseases that they'll come up with a list of. And I don't know what those are going to be. Those would be the people most likely they will recommend boosters first. And then the rest of us, at some point, we may need boosters. It's likely we will need boosters, but it could be 1 year, 2 years, 3 years. It's not clear how long that will be. And how will we know what that will be? We will know that when they do the studies to kind of measure all the rest of us and kind of track us over time and see what our kind of on whole, what our immune system does.
Fantastic. Thank you so much. Dr. Crenshaw, any other questions? You good?
Well, I just wanted to thank you very much for your feedback, Dr. Benjamin. Absolutely great information. Would you say that certainly even being vaccinated, you should be attentive to your building your natural immune system, those things, taking care of your body? Do you think that's wise?
Every single day.
Thank you.
Every single day. Every single day. One of my best friends who's a naturopath reminds me every day, it's about diet, exercise, it's about balance. Look, I've struggled with my weight my whole adult life, at least. And there's no question that you've got to continue to do those things. Getting the proper vitamins, all that stuff's going to be very important to people every day.
Fantastic.
Not just for this, but for other things.
Absolutely. Thank you. Yeah, thank you so much, Dr. Crenshaw and Dr. Benjamin. Dr. Carnes?
Yes, thank you. A couple of things. One of the things that I wanted to follow up on, given the fact that many people of color do deal with the hypertension and other things of that nature, and some of the medications that we take have a negative impact on the kidney and some of the, some other things in our bodies.
Yeah.
Are we being adequately educated as to how that makes us more susceptible to the virus? And what are some precautions that can be taken that will possibly protect us from that?
Good question.
So a couple of things. The first question is, are there medications that negatively impact us being vaccinated? And so far, no one's identified any medications that are obvious. The one that we was really studied very early on was hypertension medicine. Because as you know, there's a disproportionate number of particularly men of color, but also women with high blood pressure. And it turns on that the spot that this virus attaches to on our cells is the same spot that some of our high blood pressure medicine attaches to. So people were concerned that that might be a reason people were getting sicker who were of color. And it turns out that's not the case. That's been looked at least most of the studies that have done. I'm not sure of any study that hasn't demonstrated that that is not a problem. But I've heard cardiologists and African-American cardiologists looked at it a lot. So I think that one medication issue is not a problem. You know, we know that there are other medications that, like steroids, that reduce your immune response overall. But it reduces your immune response, and the vaccine should enhance your immune response. So if anything, it doesn't interfere as much as the vaccine will help you, I guess is what I'm saying. I do think that we have not done a good enough job by any means of letting people know that if they have diabetes or they're obese, that they have high blood pressure, they have kidney or heart or lung disease, that should they get COVID, you know, get exposed and get the disease, their outcome is going to be worse than somebody who doesn't have those diseases. And the more of those diseases that you have, the worse your clinical outcome is projected to be. So if you have diabetes and you're overweight, which often go together, you're going to do worse theoretically than someone who has diabetes or hypertension or diabetes and is obese. So the more diseases that you have, the much more likely you are to get sicker if you're exposed to COVID. Again, the argument for getting the vaccine. If, you know, if you are, Dr. Crenshaw pointed out, don't have good nutrition and you're not eating well enough, you're not going to do as well. You just aren't going to do as well if you get infected.
Yes, sir. Yes, sir.
So the answer is, yeah, we have not done a good enough job really having some really serious, curbside discussions with our folks to let them know what these risks terribly are, and just convincing them. And again, I love for them to believe every word I say, but I encourage you, listen, understand, question what I say, and then go talk to somebody else and get it validated. So if you don't get your questions answered, then you're less likely to be confident enough to take the vaccine. And it is okay to have those questions. It's okay to ask those questions and be concerned. And if I was their doctor, I would try to answer their questions and then recommend that they get vaccinated.
Fantastic.
One of the other things, and as was mentioned, we need to do all that we can to ensure that our immune systems are healthy. But with the cost of supplements, I mean, it just goes off the chart. And when you have people who are even struggling to maintain certain, economical status budgets, you know how things are going with COVID, and there are some restrictions. But the cost of supplements, are there any recommended places where people may be able to get these supplemental vitamins and things that they can get to help build their immune system? That's, I'm going to say this, from a practical perspective, not going to break the bank that's already broke.
Yeah, I'm gonna give you the honest expert advice is I ain't got a clue.
Yeah.
I don't know. As you know, the communities in which I've practiced over the years.
Yes, sir.
We have people that are figuring out how to eat versus, go to work, splitting their pills so they can, they shouldn't, but to, food or pills, food or buying their kids, some clothes. And I guess, the shout out to the fact that the new child tax credit that was just passed is going to bring, half of our folks out of poverty in this country. That's a good thing. We got to make that permanent now. But, one of my organization's goals, we recognize that societal conditions impact your health. So we've been advocates for a $15 minimum wage. We've been advocates for, child care support. We've been advocates for, clean, affordable transportation. We've been advocates for safe, affordable foods in our neighborhoods so that people don't have to, after they get off 2 shifts of work, go to that corner store and get high caloric, high fat, low nutritious foods as their only food option.
Wow.
So they can get access to, fresh vegetables again, but they got to be fresh and affordable.
Yeah.
And so we've been working hard to try to address those issues so that people can certainly get their nutrition in a natural way from the foods that they eat, and trying to make sure that their communities are walkable and bikeable and green, so that if they want to get out and walk through a safe community at night, they can do so.
Yes. But the final question, and I just want to switch a little bit. It appears to me that, it's so political when we have people who are anti-mask, as opposed to those who are, proponents. And have we entered a place where we have a society that's valuing the product over the people? And I say that from this perspective. When things are opening up, but we see the rise that's taking place in infections, but still we see businesses opening up. We see from a sports perspective, arenas opening up and allowing masses of people to come in, and they're not being required to wear masks during these gatherings. Have we entered the place where we're valuing the product over the people and the safety of the people?
Yeah, I worry about that. And I worry about the way I think in many ways we prematurely opened up some stuff.
Yes, sir.
For sure. I think that this idea of sending kids to school in communities where there's no masking is a problem. And particularly when we know we can't vaccinate the kids, we don't have a vaccine yet for them.
Yeah.
I think that's a problem. And I think one of the teachers in I believe it was in Florida quite recently, who said that she was not going to value children's lives and making decisions over money over lives. We should listen to that. At the end of the day, there are a lot of things that you can't do if you're dead. You can't enjoy a sports game. You can't go to work if you're not well or if you're deceased. And so we've got to figure out how we get people to rebalance these things so that health is valued much more than some of these other things. Now, we know that people have got to go to work. We've got essential workers. But I was incensed early on when we were not protecting essential workers. Yeah. The people that were in our grocery stores, the people that were bus drivers, the folks that had to go to work every day.
Yes, sir.
I argued that we should have prioritized vaccinations in those groups very much sooner than we did. That we should have tested those groups much sooner than we did. Because I was able to go home and work on this computer by Zoom.
Yeah.
But a lot of people weren't able to do that. Right. And I thought they should prioritize them over me.
Yeah. Wow. That's great. Dr. Carnes, Dr. Crenshaw, thank you so much for those wonderful questions there. Dr. Benjamin, thank you so much for your time today. Ladies and gentlemen, we care about you. We care about you. I wanted to hear from African-American doctor, physician, myself personally, and I wanted to understand what he thought or she thought about what was going on in our community. So this is My Healthier Health with Kevin Vaughan. Dr. Crenshaw, just nurse, for those just joining us, a recording artist, book author, a conference speaker, and healthcare consultant. Very good in that area for sure. And Dr. Carnes is a leadership coach and transformational strategist, conference, workshop, and motivational speaker. Both of them can be located on Facebook if you like, or get in touch with me. I'll be glad to get you in touch with both of them respectively. And also to our wonderful guest today, Dr. Georgia C. Benjamin. Ladies and gentlemen, he is the executive director of American Public Health Association. I thought he might know a few things about what's going on. So Doc, thank you so much for your time today. any final thoughts, Dr. Benjamin? I want to give you any final and closing thoughts before we go.
No. I want to both empower Dr. Crenshaw and Dr. Carnes for the work they're doing. Just thank them for their advocacy and their leadership.
Yeah.
You know, having folks like that on your show, simply to talk to folks and to grill guys like me, I think is very important. Absolutely.
Yeah, thank you so much. Matter of fact, Dr. Benjamin, when you approved coming on, they were the first two I thought of, without a doubt. Those were the first two that came to mind. So thank you so much for your time today, and also blessings to your family too, Dr. Benjamin, and of course, Dr. Crenshaw and Dr. Carnes as well. We thank you so much. Hey, our time is up. We got about 3 more minutes, but we're gonna get ready to roll out of here. Ladies and gentlemen, this is My Health, Your Health. We're here to help you. We're also here to answer your questions. You can actually go to American Public Health Association, the website. You just type that all in, or APHA, and you can get in touch with Dr. Benjamin too as well directly if you'd like to do that. And I would encourage you guys who have formal shows to have him come on. You know, if you can schedule it on, to have him come on and talk to your community, talk to your network as well. Also too, just for everybody's, I'm going to put the audio out on this. We got about 5 countries that are going to hear this later on through our network. And then we got about another 150,000 followers on that. And then we're going to push it out on social media, Dr. Benjamin, which is going to be another 200,000 total. So we trust a few people are going to hear it about this as well. But our goal is just to get the information out. But do your research. That's what Dr. Crenshaw talks about that all the time. So does Dr. Carnes, and Dr. Benjamin mentioned it again. Read, research, and pay attention. That's what Dr. Crenshaw tells us all the time, guys. So important to make sure we read, research, and pay attention to what's going on, and make the right decisions. And also be mindful of other people, as we talk about a lot with Dr. Carnes. Be mindful of other people when you go out, you know, and understand you may not understand the science, but be a little caring, I guess, a little more concerned about other people in the particular public areas we're talking about today. So that's what we're all about today. Well, again, ladies and gentlemen, thank you so much, Dr. Carnes. Thank you so much, Dr. Crenshaw. Thank you so much, Dr. Benjamin. Thank you so much for your time today as well, sir. Appreciate you so much.
Thanks, Kevin.
All right, thank you for your time, everybody. All right, you guys have a great day, everybody, and call somebody, let them know how much you love them today. And take care, and we'll see you next time on My Health, Your Health with Kevin Vaughan. God bless you, everybody. Take care.